Hello, my name is Sarah, and I am doing my rare disease presentation on Alexander disease. Alexander disease is an extremely rare, progressive, neurological disease that usually becomes apparent during infancy or early childhood. Less commonly, cases have been described in which symptom onset has occurred later in childhood or adolescence, or rarely during the 3rd to 5th decades of life. It generally occurs randomly for unknown reasons with no family history of disease. Though there is a genetic defect present, it is not genetically inherited. Alexander disease is considered one of the leukodystrophies, which is a group of disorders in which the primary abnormality is the inability to maintain myelin. Myelin is a whitish substance that wraps around certain nerve cells and ensures the rapid transmission of nerve impulses. If myelin is not properly maintained, the transmission of nerve impulses is disrupted. As myelin deteriorates, nervous system functions are impaired. Symptoms associated with Alexander disease vary between the time of onset. There are 3 times of onset associated with Alexander disease. The first is infantile Alexander disease. This usually occurs before age 2. Symptoms associated with infantile Alexander disease includes megacephaly, which means that the brain is abnormally large. This can be associated with delayed development, convulsive disorders, corticospinal dysfunction, and seizures. A second symptom is hydrocephaly, which literally means water on the brain. This can cause pressure on the brain, resulting in developmental defects, and may also lead to an abnormally large head size. A third symptom is failure to thrive, a general term meaning that the child is not growing and gaining weight at the expected rate. A fourth symptom are seizures. Seizures occur when normal signals from the brain are changed. Severity of a seizure can vary dramatically. Some people may only shake slightly and do not lose consciousness. Other people may become unconscious and have violent shaking of the entire body. A fifth symptom is spasticity. This means that the child tends to suffer spasms or involuntary contractions of muscles. Muscles are abnormally stiff and movement is restricted. A sixth symptom is progressive psychomotor retardation. This can include difficulties with walking, speech, and mental regression. Eventually, this can lead to the loss of all meaningful contact with the environment. Progressive means that the condition worsens as time goes on. The second time of onset is juvenile. Juvenile Alexander disease usually occurs between the ages of 4 and 10. Unlike in infantile Alexander disease, mental ability and head size may be normal. However, symptoms that may occur during the juvenile onset include signs of swallowing or speech difficulty, vomiting, ataxia and/or spasticity. Mental function often slowly declines, although in some cases the intellectual skills remain intact. The third type of onset is adult Alexander disease onset. Adult onset usually occurs in the late teens to very late in life. In older patients, ataxia often occurs and difficulty in speech articulation, swallowing, and sleep disturbances. The prevalence of Alexander disease is still unknown. 500 cases have been reported since the disorder was first described in 1949. Diagnosis for Alexander disease can be performed in 3 separate ways. The first is by genetic testing on a blood sample. As I said previously, in Alexander disease there is a genetic defect, but it is not genetically inherited. Blood samples to test for this genetic defect are one way of diagnosing. A second form of diagnosing Alexander disease is by suggestive diagnosis. That can also be made from the clinical symptoms combined with radiological studies and negative tests for other leukodystrophies. A third form of diagnosis is by MRIs. MRIs can reveal characteristic patterns that help to diagnose Alexander disease. Treatment and prognosis. There is no cure for Alexander disease. The treatment for Alexander disease is symptomatic and supportive. Each case of Alexander disease is different, and therefore the treatment is different for the person that is suffering from the disease. Hydrocephaly, or water on the brain, may be partially relieved by surgery, in which a shunt can drain away some of the fluid causing the pressure. A second form of treatment may be a bone marrow transplant. Prognosis for Alexander disease is very low in terms of survival. In infantile onset, some children die in the first year of life. Others live to be 5 to 10 years old. In juvenile onset, survival can extend several years following onset of symptoms, with occasionally longer survival into middle age. In adult onset, patients can live to be an older age. Teacher intervention is very important if you have a child in your class with Alexander disease. Forms of symptoms that may affect daily classrooms are seizures and spasms, as well as mental regression. Teachers need to research and speak with families about how to provide a safe environment for children with Alexander disease. Since each case is different, the teacher needs to talk with families about the symptoms that their child may have and ways to best handle situations that may arise. There are various websites that provide information for teachers concerning Alexander disease. They are the National Association of Special Education Teachers website, the National Organization for Rare Disorders website, and the American Academy of Special Education Professional website. There are also other websites that will be listed on your handout. Thank you.